Hey, hello everyone. You're welcome to the section with EE Gifts. Today I'll be reacting to some questions people ask regarding postpartum depression. So before we dive into the questions, I'd like us to quickly have a clear understanding of what postpartum depression is all about. Okay. Postpartum depression is actually an emotional and behavioral changes that happens to some women after childbirth. It's actually a mood disorder, okay? And this could happen as a result of maybe a sudden drop in the hormones of the woman, okay? And during this period, the woman starts experiencing sadness, unexplained sadness, anger, mood swings, and wouldn't want to socialize with people around her, including family members, okay? And actually, this mood disorder called postpartum depression can be life-threatening. It could be life-threatening. So that is why there's a need to manage it effectively, okay? So now let's quickly look at the questions I have there. I'll be attending to 5 questions today. So the first question is, what causes postpartum depression? Actually, there is no root cause for postpartum depression, or there is no exact reason why this happens to some women. But some factors could be responsible, or some factors could trigger it. So one of it is the hormonal changes, which I had earlier talked about. When there is a sudden drop of hormones, okay, it could be responsible for a woman to experience depression after delivery. So if also there have been time, or there is a history of depression of any kind in the life of the woman, it could be a factor to trigger it, okay? If also there are history, or there is a history of mood disorder or mental disorder in her family, it could be responsible. If maybe she had had it, or this had actually occurred in her previous pregnancy, it could be the case also, because if you had had it before, it can still reoccur after the delivery of other child, okay, or other children. So, but one of the basic things you should do is, once you're pregnant and you go for your antenatal, try as much as possible to talk to your healthcare provider, your doctor, or the nurses, let them know that this had happened to you before. This will help them to be able to examine you, okay? They will check out, even during pregnancy, if you're having it. And if there is none like that, after pregnancy or after childbirth also, they will help to check you, to examine you. So once there are symptoms, they will start treatments all around. So it is easier to cope or to manage such situation than allowing it to linger, because it might be complicated. So when you have anxiety, okay, after childbirth, it can trigger depression in the life of a woman. Marital crisis, unplanned pregnancy could all be factors of postpartum depression. Then if the woman is not having support, both social support, financial support, whatever support from the family members or from friends, she can be postpartum depressed. So, you know, the period of postpartum is quite delicate. You know, the woman actually need enough love, support, and care, okay? So when all this support, care, and love are not coming, anything can go wrong. So we should learn to take care of any woman around us that just delivered a baby, okay? So now I believe I have given answer to that question. So the second question here is, how do I know I am having postpartum depression? So if you're a woman and you have delivered, you just delivered, okay, there's a need for you to pay attention to your system, okay? Pay attention to your health, take care of your health. If you start noticing anything different from the way you used to feel, please talk to someone around you. Okay, some of the symptoms you might be experiencing if you are postpartum depressed is one, unexplained sadness. All of a sudden, from being happy, you become sad. You become irritated with things around you and people around you. You become angry. You know, your mood changes without any explanation. You wouldn't want to socialize with your family members, with people around you. You know, all these are symptoms and signs of postpartum depression. Also, you can also be experiencing loss of appetite. But to some people, that's the period when they eat a lot, okay? So it could be either you're losing appetite or you're eating a lot. Some people also have insomnia, okay? This is one of the signs of postpartum depression. They have difficulty sleeping. They have crying spells. Nothing happened. They didn't hear about any bad news. All of a sudden, they keep on crying, okay? So the anxiety will be there. You'll be having fatigue. You'll be tired. You'll be weak. You start feeling worthless, okay? Some people, they go to the extent of, you know, thinking that they have lost control over their life. When they look at themselves at the mirror, they feel less attractive. So the confidence over them are lost, okay? So all these are not actually facts. They are not actually true, just because they are depressed, okay? So they start having lack of interest in their baby, okay? You know, everyone or every mother will be happy to see their baby, okay? After a long while of 9 months, they'll be expecting this baby. Now the baby is here with them. So what happens? When you start becoming sad, you don't have the interest of even taking care of your baby. You want to put your baby away. You could be going through postpartum depression. So some people also lack interest concentrating in things. They become disorganized. They're not able to decide on issues, to take decisions. They start getting confusions. They start forgetting things. And it gets to the states where they start having thoughts of death or suicide, okay? All these are symptoms of postpartum depression. So, for example, if you never knew about this and you just delivered a baby, and all this I've mentioned, you start experiencing at least 5 of them, please do not sit back. Make sure you express your feelings to your family members. Let them know, look at what I'm passing through. If they're not getting any good solution and giving you any good advice or solution, you can find your way to the hospital. Tell them to take you to the hospital and you speak to your healthcare provider. Proper medications or advice will be given to you. Okay, so I believe we have clear understanding on that particular question. So the next question, question number 3, what's the difference between postpartum blues, postpartum depression, and postpartum psychosis? Okay, all these are different kinds of postpartum depression, but they operate in different magnitude, okay? When we talk about the postpartum blues, it is the same as what people call the baby blues, okay? So these actually happen to about 70% of women. And most of them, when it occurs, they don't know they don't actually know what they're passing through, but it is quite mild. The symptoms of insomnia will be there, lack of appetite, there will be sadness. Um, they wouldn't want to socialize with family members or people around them. Okay, but one good thing about this is that within the first 2 weeks or after 2 weeks of your delivery, it phase out, it will phase away. So it doesn't necessarily need any treatment or medication. All you need is to show the woman love, give her your support, give her all the best, all the care she needs. Okay, that is what she needs. So now, for the postpartum depression, it is more intense compared to the postpartum blues, okay? And this happens to about 20% of the women, according to research, okay? Now, the symptoms I had earlier mentioned are still there, but one thing is that it will interfere, or you will, your ability to do work, to carry out your daily activities will be affected. So, and you know, whenever you're being affected, carrying out your daily activities, there is a need to seek help, okay? There is a need for help. So where do you seek your help? Please, right away to your healthcare provider, okay? You'll be given medications. Don't sit back home. Don't sit back home because it could be complicated and be difficult to manage. So if one good thing I would like to tell you, if you start experiencing any of these symptoms I've mentioned, do not allow it to exceed 6 weeks because it might be very difficult, very, very difficult to manage. Okay? So for the postpartum psychosis, it is a severe mental illness, okay, which needs medical attention right away, okay? It is very, very severe. Now, patients with postpartum psychosis, they have awkward feelings, okay? The anxiety is there. They have feelings of things speaking to them. They hear things, and these things they see and hear are actually things that don't exist. People around them don't see those things. People around them don't hear anything, but they hear words, as in they hear voices speaking to them. So, you know, it is quite dangerous leaving such people being alone on their own, okay, being alone, or leaving them with their babies, because some of them might attempt hurting their babies. Yes, some of them attempt going for suicide. Yeah, so we have to put an eye on them, not just putting an eye on them. They have to be taken to the hospital so that they will get their right medications. So that is that. For the next question, which is the fourth question, is postpartum depression curable? From what I've said so far, you get to understand that, yes, it can be treated with medications. Yes, it can be treated. So once you notice that it is affecting the way you do things, you're not able to carry out your activities, you need medication. So anyone going through postpartum depression, postpartum psychosis, need medication. There are diverse medication, different medicines for it. So it will be good for you to speak to your healthcare provider or your mental health professional. You will know the right one which will be suitable for you. You can also be recommended for a therapy section where you will have to meet your therapist or your psychologist. He or she is going to help you to reset your mindset, your thinking, okay? The way you view things, the way you anticipate things. Because actually, this mood have actually, this mood disorder have actually changed your behavior, okay? You might now be saying things that differently. So now it is their responsibility. But there are actually some people that only go for the medications. They don't go for the therapy section and they still got better. So the last question I will be attending here, or I will be attending to, can I breastfeed my baby while on medications for postpartum depression? Yes, you can breastfeed your baby while on this medication. So, but one good thing you're going to do is to let your mental health professional or your doctor know that you're breastfeeding your baby. So the right medication will be given to you. Like I said, there are different antidepressants out there. Do not allow anyone to be the one to prescribe from you. Let it be your doctor to prescribe the right one for you. Okay, it's not going to affect your baby. No, your baby will be fine. Okay, so one more thing I would like to add is that this could actually be life-threatening. This mood disorder called postpartum depression can be life-threatening. So we need to manage it effectively. So some women or some family members do not know about this. Okay, so that is why I chose to talk about this, so people can get to know more about this situation and how they'll be able to manage it, because it has actually happened to some people, but they viewed it differently, thinking it was an attack. So they didn't go to get medications because they didn't see it as a medical problem that needs treatment. So they thought it was an attack. So their solutions, they went for solutions wrongly, and they did not get any positive results. The result was actually negative. So some women have died out of this particular situation. So now, from a family being happy, rejoicing that now they have a new baby, now deaths have occurred. So please, let's be warned and try to spread this news. Let people get to know about this subject matter. So I would like to thank you once more for your patience, for being part of this section. See you next time in our next section. Thank you.